It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. It is a Tuesday right here on Expresso morning show and making sure that you have a feel-good day indeed. Now, of course, on Sunday was World AIDS Day and it is commemorated on the 1st of every December every year. Now, this very important day on the health calendar is used to unite in the fight against HIV and to show support for those living with HIV and remember those we've lost to the disease. Now, South Africa has the biggest HIV epidemic in the world and accounts for a third of all new HIV infections in Southern Africa. Now, here to tell us more about HIV and AIDS in South Africa, please welcome Multimedia Health Specialist, Dr. Darren Green, and Infectious Diseases Specialist and HIV Clinician, Dr. Emille Reid. Thank you so much, gentlemen, for joining us this morning. I think let's start from the beginning. What is the biggest difference between HIV and AIDS?
Yeah, that's an easy one. I think I'll take that one. So HIV obviously stands for human immunodeficiency virus. And what it does, it's a virus that attacks the immune system, specific cells in your immune system that keep you protected, like I call the T cells, or the T helper cells more specifically. And what HIV actually does is it goes into those cells, it affects the genetics of those cells and destroys them. So those cells are important in keeping you safe and immune against bacteria and fungus infections, particularly. So when those get wiped out, you then are laying bare and vulnerable to infections, particularly that can affect most of the systems in the human body. And then AIDS, on the other hand, is the progression of the disease during that phase. As more and more T cells are wiped out, T helper cells, you go through different disease phases where we classify them in stages according to which clinical symptoms and diseases you can contract in terms of opportunistic infections and associated other pathologies. But it's a journey and a continuum. So acquired immune deficiency syndrome is on that, later down, the progression after getting the virus, and then the different stages to AIDS itself.
And I mean, South Africa is the highest infected country in the world. How quickly does it develop from HIV to AIDS?
Well, it can take a few months up to 10, 12 years. It depends on the individual on the one side. And in South Africa, we have the coexistence of tuberculosis. And tuberculosis is like adding fire or fuel to fire. It actually aggravates the progression of HIV. And you can actually see people going from stage 1 to having complete stage 4 full-blown AIDS, as people say, within a year or so. So if we treat HIV, we need to look for tuberculosis as well.
Absolutely. I actually want to ask you, what is the current stats in South Africa?
Yeah, so one of them, I could mention one, maybe you can build on them, is the fact that if you take people aged between 15 and 49, 1 in 5 people have HIV.
Oh, wow.
That's like 20%. So if you're walking in a mall one day, you just think 1 in 5 of the people there aged between 15 and 49 are HIV-infected individuals.
That's extremely high.
And I think the one thing I can add, Darren, is that HIV doesn't discriminate. HIV doesn't have a face. And that is why it's so important for everybody to know their status. Because despite being beautiful and looking healthy, you can be HIV infected.
And that's what I want to touch on. What are the symptoms that someone can look out for? Because, as you mentioned, it does not have a face. So you might think you're pretty healthy, you're looking good, your weight is still intact. So what should you be looking out for?
Exactly. I actually think that we shouldn't look for symptoms. We should actually all know our status, because by the time we develop those symptoms, we are already in trouble.
Absolutely.
And the best thing is to know your status while you're still healthy in order to maintain that health you had up to that stage, rather than to become sick, have symptoms, and then treat your HIV. So rather know your status
beforehand as opposed to now, then afterwards.
Yes.
And what is the process of getting tested for those who doesn't know and is maybe even scared to go out there?
Scared.
Yeah, well, I think that people don't know. It's so easy nowadays to have access to testing yourself. That can be done for free at our community day hospitals, your clinics, so money is not an excuse to get it done as a priority. You could also have it done privately, discreetly at a pharmacy. Many pharmacies offer that
Yes.
service as well.
Yeah.
And there's certainly a lot of NGOs as well that also have centres set up in the different communities across South Africa, not only in the Western Cape, Gauteng, Mpumalanga, etc. as well. So you need to make an effort. If you can research Facebook, you can research a place to go and test it.
And maybe if I can add to that, Darren, it's not just about going for a test, because there are even self-testing kits available. In pharmacies. And it's all about getting counselled
Yeah.
and educated before testing and getting pre-test counselling as well as post-test counselling.
Yeah.
You can just imagine doing the implication of doing a test on yourself in the privacy of your own flat, not knowing what you should do with the result.
Yeah,
I mean, it can have dire
detrimental.
consequences.
Yeah.
Exactly.
And there's so much stigma around it, socially
Yeah.
and culturally as well, that affects so many misconceptions about how to deal with a positive result. And I think that's where the post-test counselling also becomes really important.
This is a very important conversation, and I'm really glad that we are continuing with part 2 a little bit after this conversation with Graham.
It's my feel good breakfast show.
Welcome back to your Feel Good Breakfast Show right here on SABC3. It's Expresso Morning Show. Now, before the break, we were speaking about World AIDS Day, which happened on Sunday. And we're continuing the chat with Dr. Darren Green and Emille Reid that is still here to answer more of your questions. We did ask that you send in questions. So you have any questions for the doctors, they are here. So send that through onto our Facebook post. Yeah.
Dr. Green, before the break, we established the difference between HIV and AIDS, the symptoms that we should be looking forward to, and we've stated that it's important to just go get tested, right?
Yep.
Now, the question that I have right now is, how can HIV and AIDS be prevented? I mean, I know it sounds like a very simple question, but you'd be surprised that a lot of people, you know...
It's a extremely topical question. And I think we should look at prevention in the broader sense. There's mother-to-child prevention. When the mother tests positive, we prevent it going to the baby. And I mean, for the last 12 or 15 years, I have not seen one baby being born to a HIV-positive mother. So that's amazing. The second thing we need to look out for is post-exposure prophylaxis or prevention. For we as healthcare workers working with patients that are HIV positive, blood products on a daily basis. And I mean, in the past, these drugs were horrible and they had tremendous side effects. The drugs we have available nowadays does not have any side effects. So there's no reason for you not to take preventative treatment. Obviously, for the broader community, things like condom use, abstinence, stay loyal, etc., are still relevant. It's important because that's the basis of prevention. But I mean, if you look at other things that people are doing, things like pre-exposure prophylaxis, PrEP. And PrEP is where we are using antiretroviral therapy in those people that are HIV negative, but are at high risk to contract it. And those are the MSM, the men having sex with men, the drug users, etc., the transgender people. And the important thing is, we need to think about it. We're actually giving a drug to somebody who is healthy, and those drugs might have side effects. But it's still out there. And this is a drug that needs to be taken on a daily basis, every day, in order to prevent transmission of HIV in those high-risk individuals. So you can just imagine, if you have a chronic disease and you need to take medication on a daily basis, it's already difficult to adhere, let alone being healthy, to take medication on a daily basis.
And we actually need to modify the risk behaviour as well. It's not it's no use just taking a pill to decrease your chances. It's a full spectrum of multifaceted approach to decreasing the risk behaviour involved.
Absolutely. Now, have we gotten to the point where there's an actual cure for the disease?
lots has happened on that front. I mean, we are introducing new ARVs at our clinics that are being rolled out. Dolutegravir is one of them. Sure, Dr. Reid.
Dolutegravir.
Yeah,
Okay.
Dr. Reid will speak a bit more about that. And then there's some exciting new stuff on the horizon as well.
Yeah, exactly. I mean, if one think of the current ARVs that we have available in this country, you've all heard stories of people robbing patients of their ARVs,
You heard about this?
smoking it in order to get hallucinations and to get dreams. And then also people using ARVs to develop niope, you know, the cigarettes that they smoke together with mandrax and dacha in the
Mixing
townships. They're
agent.
mixing antiretroviral therapy. So, and efavirenz is the drug that classically gives you central nervous system or psychiatric effects. And efavirenz is currently being replaced by a drug called dolutegravir. And dolutegravir is one of those ARVs with very few side effects or almost zero side effects. But it can only be used in certain patient populations. Patients need to be told that this is not a quick fix. Although it has way less side effects than the efavirenz, it still causes a lot of weight gain within the first few years, especially in our African ladies. And then, I mean, that is very, very important. So, and I mean, for anybody that was stigmatized by the previous ARVs, developing, changing in body formation, losing fat, etc., dolutegravir can cause an increase in weight, and it's something to need to look out for. The second thing is it should be used with absolute caution in people that are pregnant, because you remember last year in Botswana, it was described that there were slightly higher congenital abnormalities in babies born to women on dolutegravir.
It's not for everybody.
So it's not for everybody at this point in time, although it's a fantastic ARV. Coming to a possible cure, we are unsure how far we are with regards to that. But there are certain things that they are looking at in order to eradicate HIV. For instance, they are looking at certain gene editing tools that can eradicate the genetic material of HIV within the cells in order to get rid of HIV in the latent or the dormant phase. So whereas ARVs kills the virus in the blood circulation, this gene editing tool can eradicate HIV that is dormant, which means that people, on a theoretical basis, can become HIV negative in due time.
You feel like you always know things, but then when you come, I'm just like blown
And you
away.
unpack it properly for us to understand.
A gene editing tool. Remember that?
Now, we also have a social comment that came through from Michelle Robbenheimer. She said, we had World AIDS Day at church on Sunday and we rocked with our red ribbons, me and my mom. Look at that. That's amazing. Just
Amazing.
Amazing.
Keep it up, Michelle.
We actually need more of that. So we're going to put on our ribbon as well just to commemorate this day. But thank you so much to Dr. Emille Reid and Dr. Darren Green for coming and always continuing the conversation with us. But of course, like we said, go out there, be safe, but most important, just prevent it and always just
know your status,
know your
man.
status. If anything, know your status.
Absolutely.